Hi Professor, my name is Deanna Frick and today I will be presenting my final presentation. If you're hearing this, I hope you have a great rest of your school year and a good summer. This presentation focuses on a common but serious hospital error involving insulin administration without a current blood glucose check and how we can improve patient safety using a structured quality improvement process. The error I chose involves a patient whose blood glucose was not checked for multiple hours, but they were still given the scheduled dose of insulin. Because insulin lowers blood sugar, this caused a significant drop in their glucose levels, leading to severe hypoglycemia. This is especially dangerous because hypoglycemia can result in symptoms like confusion, loss in consciousness, seizures, and even death if not treated. This situation is preventable and highlights the importance of following proper protocols when administering insulin. Here is a breakdown on how this error occurs step by step. The patient was supposed to have a routine blood glucose check, typically before meals. However, the CNA or nurse either missed or delayed this blood sugar check. Despite not having a current reading, the nurse proceeds to administer insulin. At the same time, there was no alert or reminder system in place to flag that the glucose check has not been completed. As a result, insulin was given without verifying the patient's blood sugar level, which caused the patient's glucose to drop dangerously low. This shows how multiple small breakdowns can lead to a serious patient safety issue. There were obviously several root causes that contributed to this error. First, there was a missing vital sign task, meaning the blood glucose check was not completed. There was also poor communication between the CNA and the nurse, which may have led to assumptions that the task was already done. There had been a lack of accountability from completing glucose checks, and the time pressure or understaffing may have made it easier for this step to be overlooked. Additionally, there was a failure to follow protocol, since insulin should never be given without a current blood glucose reading. Finally, the safety system itself was weak. There was no electronic health record alert or hard stop to prevent insulin from being given without documentation. All of these factors together create an environment where this error could occur. The QI method I am using is PDSA. For the plan phase, we start with an aim statement. The goal is to reduce the number of instances where insulin is given without a current blood glucose check by 50% within 3 months on the hospital unit. The objective is to ensure that 95% of patients receive insulin have a documented blood glucose level checked within 30 minutes before and after administrating. To measure success, we will look at outcome measures such as the number of hypoglycemia events or related adverse events in the hospital. We will also track process measures, including the percent of insulin doses given with a documented glucose check and the percentage of glucose checks completed on time. Lastly, we consider balancing measures such as any delay in medication administration or increased staff workload and stress to ensure the change does not negatively impact workflow. In the do phase, we'll carry out the tests. This involves implementing a mandatory pre-insulin glucose checks protocols on one intensive care unit, aka ICU, for 2 weeks. Nurses are instructed to check blood glucose within 30 to 60 minutes before administering insulin and to strictly follow the rule, no glucose equals no insulin. Electronic health record reminder alerts are also activated to notify staff when no recent glucose value is documented. In addition, brief staff education is completed before starting the test to ensure everyone understands new expectations and procedures. In the study phase, the team analyzes the results from the 2-week pilot. They review data such as documentation of pre-insulin blood glucose checks, the number of hypoglycemia events defined as blood glucose less than 70, and any incidents or near-miss reports. The team evaluates overall compliance and safety trends and compares this data to baseline data from before the intervention. This helps determine whether the changes lead to improvement in both process and patient outcomes. In the act phase, decisions are made based off of results. If compliances reach greater than 95%, there is a reduction in hypoglycemia events, then interventions can be expanded hospital-wide. If the goals are not met, the process will be refined. This could include improving staffing support, adjusting workflow timing, and adding more automations. The PDSA cycle will continue to be repeated until the process becomes reliable, effective, and standardized across the unit. To successfully implement this change, it's important to involve nurses directly. They will be given real-life examples to show how this error impacts patients and how this improvement makes a difference in actual data. Simple tools like the phase no glucose equals no insulin will help reinforce expectations. Electronic health records prompts will also help reduce risk by providing reminders. Additionally, nurses should be included in the planning process so they can help shape the workflow. This makes them feel heard and more engaged. The reason for doing this is that it reduces medication error and liability. It creates a clear explanation during a busy week or shift and improves patients' outcomes and patient safety. CNAs also play a super important role in this process. They need to clearly understand what signs and symptoms of abnormal blood glucose to watch for, such as sweating, confusion, and shakiness. They should also understand the importance of timing, especially completing glucose checks before insulin is given and rounding tasks to the appropriate time interval. It's essential that they report any abnormal or delayed readings immediately and maintain open communications with nurses or other healthcare workers. I say this because a clear expectation reduces confusion on the CNA's part. It prevents any emergencies and overall improves teamwork and workflow efficiency. Overall, this project focuses on improving patient safety rather than placing blame. By showing real data and explaining the risks to patients, staff can better understand why this change is necessary. The process should be communicated in a simple, consistent, and non-punitive way. The main goal is to reinforce that everyone is working towards the same objective, which is improving patient safety and preventing avoidable errors. Then this citation supports the importance of timely glucose monitoring. It shows that delays in monitoring during insulin protocols are associated with increased risk of hypoglycemia in hospital settings. Okay, yay, thank you, happy summer.